Welcome to The Spill, Season 2, Episode 5. On this episode, I'll be talking to an obstetrician gynecologist about pelvic inflammatory disease. So stay tuned for this very interesting discussion. Today's episode is sponsored by Nature's Discount Nutrition Center, your health and wellness store, and Anu Maje, a cookbook by Victoria Matthew, Ophelia George, and Kerwin George.
I visited Nature's Discount at 7 Great George Street in Roseau, where I had an interesting and informative conversation with staff about weakened immune system and ways to strengthen, change one's lifestyle and diet. They recommended supplements and teas explaining what each is good for. As I browsed, I noticed vitamin, herbal, and mineral supplements, sports nutrition, men's, women's, and children's health products, dairy alternatives, healthy snacks, herbs, whole fruits, and more. Pay a visit or call 440-0175.
Dr. Robinson-Amour, it is so great to have you on The Spill.
Thank you for the invitation. We've been looking forward to this for a while.
Yes, it has been a challenge, and you are actually the first OB-GYN on The Spill. So
I'm going to take that as a privilege.
yes. So it's definitely a special show because we have been, and the audience have been asking for an OB-GYN to be on for a while. So we're going to talk today about something that actually a lot of people talk about and ask me about, and I really wanted to get some information out there about pelvic inflammatory disease. Something interesting happened to me where a woman said to me she felt pain in her pelvic area, and she Googled, and this is what came up, as well as some other as well as some cancers.
Yeah, there's lots of things that can kill you on Google.
Yeah, so she was, like, what's that? So I wanted to know from you, what is pelvic inflammatory disease?
So pelvic inflammatory disease, more affectionately known as PID, as more people will know it, is an infection of the upper genital tract. So the lower genital tract is considered what we can see, and then the vagina, okay? The upper genital tract is the uterus, the tubes, and the ovaries.
Okay.
So my favorite little analogy I like to use is think of the vagina as the driveway. The cervix is the front door. The womb or the uterus is where the family grows, okay? They have 2 satellite dishes coming out on either end. Well, there are poles to hold them up, and then the satellite dishes are the ovaries. Okay. So when we have an infection from the door to the satellite dish, that is considered a pelvic inflammatory disease.
Okay. So all the way from the door.
Yes.
So the driveway is not included. And I really like that analogy. I've told you that before. The vagina as the driveway, the cervix as the door, and the womb as the home.
Yes, that's where the family grows.
Right. So I really like that. So from the doorway beyond.
Yes.
Okay. So what causes that infection? What can cause an infection like that to arise?
85% of pelvic inflammatory disease is associated with some sort of sexually transmitted infection. So we're looking at gonorrhea, chlamydia, trichomonas, mycoplasm.
Okay.
Can also cause it. And when we have a coexistent infection with like a bacterial vaginosis, that can allow for an infection that would usually just stay outside the front door to now get in.
Okay.
So
how would somebody, what signs and symptoms would lead somebody to know they have an infection or they possibly have pelvic inflammatory disease?
Well, the thing I tell all my patients is to know your body.
Okay.
So that way you know when something is off. Because there are several different ways that this can manifest, this can present itself. So when you have acute PID, usually have symptoms within a week or two. The pain is getting progressively worse. You may have a fever. Okay, you may have a mucopurulent or a very mucousy, foul-smelling green-yellow discharge. Okay, or you may not have any of these, but a dull pain on your pelvis area.
Okay.
Okay, so it's about knowing your body and knowing when something is off and seeing a gynecologist.
Okay.
The diagnosis is made clinically, so we don't necessarily have to send out labs and stuff like that. We do what we call a bimanual exam, which is one finger in the vagina and the other one palpating the abdomen. Okay. And first we look for what we call cervical motion tenderness. So with cervical motion tenderness, when I flick the cervix with my fingers, that causes pain. That shouldn't. So in a normal exam, it's uncomfortable, but it's not painful. Usually with patients with PID, they're jumping off the bed when I touch their cervix.
Wow.
Included in that is also uterine tenderness. I push the cervix and the uterus together, and if that also causes pain, and then we go out to the sides and we look for whether or not the fallopian tubes are involved or the ovaries. The thing about early diagnosis and, again, knowing your body and bringing yourself to the appropriate specialist for the appropriate diagnosis is that something can start off very insidious, slow growing, and then you can end up with what we call a pelvic abscess.
Okay.
Or a tubo-ovarian abscess, which needs to be hospitalized and treated with IV antibiotics. Whereas I wouldn't say the normal, but the usual more mild to moderate PID, we can usually treat as an outpatient.
Okay. So
It can get even worse than that, okay, and affect the lining on the inside of us called the peritoneum. That's like one of our inside skins, okay? So much so that it also can affect the liver, causing something called Fitzhugh-Curtis syndrome. Okay.
So now going out of the reproductive
Yes.
tract completely.
Yes. So it can go from being a very mild disease to something that can land you in the hospital for a while, even needing surgery.
Wow. So I want to go back to diagnosis. You're doing a pelvic exam and there is pain, as you mentioned, when you flick the cervix. Okay, there might be uterine pain. Is there anything else, though, that could cause that pain?
Absolutely.
So, like, how do you know for sure that this is what it is? That's where I'm going to.
There's specific things that I mentioned in terms of the pain, of all the areas that I mentioned. If I find a mass in the pelvis, it could be an abscess, or it could be coming from one of the other organs that are surrounding the area, like the bowel. Okay. So we initiate treatment empirically immediately because of the consequences that I told you about, how it can escalate into something very dangerous. So we immediately initiate therapy. However, if I feel something on your exam, we're going to do an ultrasound to see, okay, is this coming from the uterus, from the tubes, from the ovaries, or is this coming from the bowel?
Okay.
Or somewhere else that we still need to investigate.
Okay, so you can do further investigation.
Yes.
Okay, so what would the treatment be?
Antibiotics.
Okay.
Antibiotics. So usually we do 2 types of antibiotics, sometimes 3, depends on my suspicion for whether or not there might be some gonorrhea involved. Okay, because usually we treat gonorrhea with ceftriaxone, which is a shot. You can treat it with other things, but according to the CDC, that's the standard of the guidelines. Okay, so and then we treat the rest with doxycycline and flagyl.
Okay, so and typically, how long would be your course of antibiotic treatment?
1 week.
Okay.
1 week.
All right.
If you're more of a serious case and we have to bring you into the hospital, then we'll just dependent on how you're responding. Okay, usually if we have to bring you into the hospital, we'll give you at least 72 hours to respond to the antibiotics.
Okay.
If you don't, then we're going to the operating room.
Okay. So, doctor, what if PID remains untreated and some of those, complications that you mentioned arise? What's the outcome like for a woman with untreated PID?
So untreated PID that becomes complicated will land you in the hospital. Okay, you're not going to get away from that. There is what we call also subclinical PID, which is some women have just like an indolent pain in the lower abdomen. It may go away. Later on in life, she's trying to get pregnant. We have infertility issues. When we check, the tubes are blocked. That's one sign that she may have had PID in the past.
Okay.
But it did not give her those bold symptoms that brought her to the doctor. Okay, but when we do laparoscopies, that when we put the camera through the belly button, we can directly look at the tubes and see, okay, those are inflamed, they have scar tissue around them. We look at what we call the fingers of the tubes because they're what kind of entices the egg to come from the ovary and go into the fallopian tube. So the fingers are too fat, they can't do their job very well.
Okay.
And PID usually will have that kind of effect on the tubes, making them less effective in what they are supposed to be doing.
Okay, so possible
Infertility,
infertility
yes.
as a result of untreated PID. But now, and I know, and I'm asking because I know a woman might be thinking, okay, I used to have a dull pain in my pelvis. I never checked it out. Am I possibly now infertile because my tubes are blocked? Like, people who have this sort of panic maybe when they hear about that. What would you say?
Well, usually we don't check out the plumbing until we're trying to use it. So at that point, if she's coming to me to asking about fertility treatment or that she might be infertile, one of the tests that I will order is something called a sonohystogram, which is while doing a live ultrasound, I'm pushing fluid through the uterus and watching the architecture inside of the cavity of the uterus and also watch to see if that water spills outside of the uterus. Okay. If it spills outside of the uterus on both sides, it tells me that the tubes are patent and I should not have anything to worry about. If she's gone through infertility treatment and she's still unable to get pregnant, then we do a surgery. A laparoscopy is my choice because it's more minimally invasive.
Okay.
And then we can visually look at the tubes and see what the quality of the tubes look like. And then we can also turn the camera up and look at the liver. And in people who have had severe PID in the past, they will develop scar tissue between the liver and the abdominal wall.
Okay.
So when we look at that, we say, yep, Fitzhugh-Curtis syndrome, PID.
And is it possible for somebody to have more than one occurrence of PID in their lifetime?
Yes. Yes. And the more you have is the more likely you are to become infertile.
Okay.
So this is why safe sexual practices is very, very important.
Now let's talk about that. So you mentioned that there are certain STIs which may lead to PID, gonorrhea, chlamydia. You mentioned. What about what is a woman looking for in terms of symptoms of these STIs? So that maybe you are aware and you catch it before it even progresses that far.
And again, know your body.
Okay.
Know what your discharge looks like. Know what your discharge smells like. Know what you are like. All of us are going to be different.
Okay.
Okay. So if you notice that your discharge is changing color, mine is normally white. Now it's like a yellowish color. No, sometimes it's green. That's not normal. That you need to bring to the attention to somebody so we can check it out and make sure that you're okay or diagnose whatever is causing your discharge to have a different color and odor.
Okay. And I know there's a lot of fear, a lot of, I would say misgivings about, going and talking to a medical practitioner about an STI. Women may think, there may be some sort of judgment involved if you do.
I completely agree with you on that because we actually had a special running to encourage women to come testing in the office for STIs, and very few people took up that opportunity.
So what would you say to encourage, women to get over that, that
take
panic?
Responsibility for your body. If you are sexually active, you're not using protection, then you need to check yourself.
Okay.
On a regular basis. So usually I kind of try to stick it with the pap smear. So when you come in once a year with the pap smear, let's just do your routine, make sure everything is fine, that we haven't picked up anything along the way.
Okay.
Okay, if you're having symptoms, then you come in and then we'll check.
Okay. Are the STIs, which may lead to PID, are they rare or are they common? I don't know if you have any statistics in our population or just
don't
from your
have statistics,
observation.
but I can give, yes, I can give you my anecdotal observation.
Okay.
Okay. Most people, like I said, 85% of women who end up with PID usually have an STI. So when they come in, I would say at least 40 to 50% I've seen in our population. Okay. The unfortunate thing, though, is that most times the partners don't get treated or refuse to get treated because it's not me. I didn't bring it to you. I didn't bring it home. But you've been intimate with me. So no matter who brought it home, if we're going to stay together or you're going to go with somebody else, you're going to pass it on. So let's get treated. So what I usually will do with my patients is I will treat you and I'll give you a prescription for your partner. That way I ensure that you're going to be okay because he's going to take the medication because now he doesn't have to go to the doctor.
Yeah, so you kind of eliminate that discomfort for the partner. Okay, this is I am very interested in this because I'm thinking now, a woman is diagnosed with PID. She comes to you. That's your diagnosis. Does she need to, at that time, and you mentioned that you would treat right away, does she need to test for STIs at that time?
I recommend it.
Just to make sure. Okay.
I recommend it. The treatment is still the same.
Okay.
Okay. But I do recommend it so we know what we're dealing with.
Okay.
Okay. So if you didn't respond to the antibiotics, because we do have drug resistance amongst these same STIs. So if you did not respond, at least I know, okay, this is chlamydia and these are my other options that I can treat you with.
Okay. Okay. And whilst because I'm still on this STI topic.
Because that's the culprit here.
You did say, though, that, there might be another culprit. You mentioned bacterial vaginosis, which so is the woman, I'm thinking of the dynamic between the woman and the partner again, and having that news about a possible STI. Is it, how frequently are we blaming an STI? I want to go back over that. Like, how frequently is PID caused by one of the STIs that you mentioned?
So usually there's actually like an age stratification.
Okay.
Okay. The younger you are, the most likely it is to be an STI. Because we are usually changing bedfellows a little more when we're younger.
Okay.
And we're a little more naive than when we're older.
Okay.
So usually when we're older, it's more likely either E. coli or some of the respiratory bacteria. Don't ask me how it gets there. Well, I know how it gets there. Some of the respiratory bacteria and other bacteria that can cause the PID.
So that's interesting. Age is one of the factors.
Because when we're younger, we're more risky. We have more risky behavior. We have, we like take less precautions. We believe that we are infallible. So, nothing can hurt us. We don't get that.
Yeah, in the invincibility age.
Yes.
Yeah. Okay. So that is definitely that is interesting. Doctor, I wanted to go back a bit because I don't think I touched that with the woman who may have had untreated PID and who may now be experiencing blocked fallopian tubes, and you mentioned how you would check for that. What are her options if you find out that those tubes are indeed blocked, if that plumbing is indeed blocked?
So we do microsurgery because the tubes are actually very small. They're probably about half the size of my finger.
Okay.
So they're extremely small.
Okay.
So you're working in a very small space to try to open that up. And, if there's scar tissue or, sometimes we have to thin out the fingers. Okay, so we have special instruments that we use to do that as well.
Okay.
So we do surgery on the tubes. The thing is that surgery itself causes scar tissue. So there is no guarantee that even if we do surgery to correct those problems, that they're not going to reoccur.
Ah,
So the safest thing is to not get PID.
yes. I can imagine, in a perfect
world.
world.
In a perfect world, yes.
Yes, you just avoid the culprit in the first place.
But you know what? It doesn't necessarily mean that your partner is bad or that, especially if you just got into a new relationship, it doesn't mean that he went out and he, slept with somebody else. It could have been something that he's carrying. And because he did not get treated for whatever reason, whether he was being stubborn or he didn't know, because a lot of men won't have symptoms.
Yes, that's important.
Sometimes they do have some green discharge from the penis or elsewise, but most of them won't have symptoms.
Asymptomatic.
Yeah.
And I think that's a word we're very, very aware of now, asymptomatic, because of, dealing with COVID. Yes. So everybody knows about symptomatic versus asymptomatic. So a lot of men may be asymptomatic
Yes.
for gonorrhea, chlamydia. Yeah. Okay.
When they do have symptoms, they usually will have burning with urination and a discharge from the head of the penis.
Okay. So, I think my curiosity has been, satisfied. I hope if people have questions, that of course they continue this discussion in the comments of this show. But my last thing to you is, how do women basically safeguard, and I just want you to reiterate some of the things you've already said, safeguard their reproductive health, especially in light of a condition like PID, which may affect that reproductive health?
Condoms.
Okay.
Birth control pills will prevent you from getting pregnant. The IUDs are also a form of birth control that will also prevent you from getting pregnant, but none of these will prevent STIs.
Okay.
Condoms is the only thing that we have that will prevent STIs. So if you're in a new relationship, if you are in a relationship where you're not necessarily have 100% trust for your partner, then keep that condom on.
Okay.
If he refuses to keep it on, find another friend.
Find another friend. That's what the doctor said. Doctor, share with me as we end, your location, where do you practice from, and give me some information about your practice, because I know there will be people watching like, okay, I maybe need to take her up on the offer to get that, check. That STI check. Let me make sure that everything is okay. So give me some information about your practice.
Since we're doing this, I'm going to run the promo again.
Okay.
Okay. So that women, if you're interested, you can come. You get your results in 10 minutes. It's done right there in the office. You're not going to a lab to somebody else to read everything is privately done in the office.
Yeah, I know a lot of people have concerns about that. Like, people will know their business.
Privacy is an issue in our country, unfortunately.
Yeah.
So, but we take it very seriously in our office.
Okay. So your location?
We're upstairs Robinson's Bakery.
Okay.
On the second floor, opposite Astafans, upstairs Robinson's Bakery. We provide the gamut of care for women's health, from pediatric gynecology to geriatric gynecology and everything in between.
Nice.
So from you starting to have your period to if problems with the period, PCOS, getting pregnant, trying to get pregnant, staying pregnant, we run the gamut. Menopausal symptoms, issues with menopause. We take care of all of that. PCOS, endometriosis.
Okay. And of course, PCOS is my, personal topic of preference. so maybe sometime we can have a discussion about PCOS.
I would love that, because there's a lot of disproportionately here. Since I've been back home, I find more women with PCOS than I did in the States.
Okay. Yeah. So that's what kind of started my platform in the first place. So, so maybe we can have a conversation about that. But doctor, I'm so happy that you gave me this time, and really decided to help with the education drive so women can learn more about these conditions that affect us and that sometimes we're unaware of completely.
Well, it's our job to educate everybody so that they know how to take care of themselves and they know when to ask a question.
Yeah. Definitely. Yes. So So thank you. And I hope to see you again on the spill
Thank you
on some other program that I have.
Thank you for having me, and I look forward to it.
Thank you.
I visited Nature's Discount at 7 Great George Street in Roseau, where I had an interesting and informative conversation with staff about weakened immune system and ways to strengthen, change one's lifestyle and diet. They recommended supplements and teas, explaining what each is good for. As I browsed, I noticed vitamin, herbal, and mineral supplements, sports nutrition, men's, women's, and children's health products, dairy alternatives, healthy snacks, herbs, whole fruits, and more. Pay a visit or call 440-0175.
Thank you so much for looking at this episode of The Spill. If you liked this episode, and I know you did, make sure to share it so that your friends and family can get a chance to look at it too. Thank you so much to our guest, Dr. Diane Robinson-Amour, for joining us on The Spill. And thank you so much to our sponsors for continuing to support The Spill. Nature's Discount Nutrition Center, your health and wellness store, and Anumage, a cookbook by Victoria Matthew, Ophelia George, Cohen George, and the rest of the family. Remember, Women's Health Plus. Like, share, subscribe.